the most common complaints of older adults are related to memory loss. Concerns about memory loss can be very troubling, especially since it can be difficult to know whether mild memory changes are consistent with aging or if they are the first signs of something more serious. Joining me now to talk about memory disorder is Laura Levitan, a licensed clinical social worker with Baptist Memory Disorder Clinic. Laura, thanks for being here.
Thank you for having me.
Well, who should be concerned about memory loss? And tell us a little bit about what they may be experiencing when they go to seek help.
Okay. Actually, everybody should be concerned about memory loss because it does not just affect persons who are older. That's kind of a misconception that just old people have memory loss. There's many reversible causes of memory loss as well. Some of the reversible causes of memory loss are sleep apnea. If you do not get enough oxygen to your brain cells die. Depression and grieving. When you are in the process of depression or grieving, your mind is not your own. You can't focus and concentrate. And some of the prescription medications can cause memory loss as well. I'm going to look at my notes because even I can forget things. Low vitamin B12, low thyroid, and anemia. Those are checked by doing blood work so that we can determine whether or not those levels are low. If those are low, then just taking vitamin B12 over the counter is not going to absorb enough in your belly.
Well, do most people notice these conditions or situations themselves, or do they come to you because maybe a family member has brought this to their attention? How do they get from, especially if they're depressed and in these kind of situations, that's enough on your mind, much less trying to figure out what else is happening. How do people come to you?
People come to us because they're having memory problems and they recognize it, or caregivers refer them, or family members refer them. Sometimes when a person has moderate to severe dementia, they do not recognize that they have a memory problem. So their caregivers take the initiative and bring them in to the Memory Disorder Clinic. At the Memory Disorder Clinic, we're looking for reversible causes. We don't want people to have dementia, but if they do have dementia, then we look at mild, moderate, or severe and try to help the family through that process by education, support, and also looking at safety for them.
Right, so you're dealing with both the reversible and something that may be more progressive that is age-related.
Yes, and I have done memory screenings on persons as young as 18 and as old as 100. There is early onset dementia. So sometimes when a person has a family member with dementia, they're even more concerned about it. So it's kind of reassuring to get a baseline to know exactly where you stand with your memory screening.
Well, you're mentioning screening, and I know we think of screening for other health situations. What is a memory disorder screening?
We use the Montreal Cognitive Assessment Test, and it takes about 30 minutes to do the actual screening. And it's
tell us a little bit about the test, though.
Okay.
What are they being asked to do?
It's questions and answers, and I don't know if we can zoom in on this, but this is what it looks like.
I'll hold it up right here. Just tell us a little bit so I see some images.
It takes about 30 minutes. It's divided into several sections. This is the visual spatial. There's a naming section and a short-term delayed recall section, an attention section, and a language. Also orientation, and you know your results immediately, so it's kind of reassuring. And then we talk about the reversible causes and look and see if any of those things are potentially affecting the person. If they score normal, then they have a good baseline. If they score abnormal, then we go on to do further evaluation with the neurologist, possibly the neuropsychologist who does age and education corrected more in-depth testing, because this is just a screening. And then I'm the social worker. I meet with each person for an hour and look at whether or not they have depression, whether or not they've been under a lot of stress, and look at how their memory is affecting their activities of daily living.
Okay. And some of these other things besides the depression, some of the other medical conditions or medications, and at what point does their primary care physician brought into that, if it is something that's diet related, medicine related? Who gets all that going?
We work in conjunction with each primary care physician. They are kept in the loop. The neurologist, their report and my report gets sent to the primary care physician to follow the patient as well. And that way there's good continuity of care.
So obviously the goal is to see some of this reverse. So once they've done the screening and you've determined where they are and who needs to be involved, let's talk about treatment. What kind of treatment is available?
There are currently 4 memory medications on the market. There's Aricept, Namenda, Exelon, and Razidine. These medications, however, do not cure dementia. They only maintain that person at the point in time they start taking the medicine. If they stop taking the medicine, they can dip down to a lower level than they were before and not get back up. So it's real important for family members to oversee the person's medications and make sure that they are taking the medicine correctly and not to stop taking the medicine once it's started.
Okay. Well, say someone is noticing a family member with some type of problem. A lot of people do want to be in denial. I know it's, I don't, it's not that. What would you say to, say, a spouse or a family member of someone? Why is it important to get them in there?
Early treatment is important. Even though there's no cure, we can help maintain that person's independence for longer. And if you come in and have a free memory screening, at least you have a baseline, and then you can take it from there if you need to have further treatment by the neurologist or neuropsychologist. But to do nothing, I tell people, be afraid to do nothing because it's just going to get worse. With the medication, it's like cancer. There is no cure, but there's treatment. So we want people to be able to live at home and independent for longer, and most people want to stay at home and live independent, so that's our goal.
And that's our goal at the Council on Aging. So it's great information, and we appreciate you being here. Thank you.
Thank you very much.